And talking about empowerment, through knowledge, yes, we just learned about hormones a little bit. Hopefully you took something out of there that you can utilize and use for your wellness, because let's face it, I mean, like I said, once you turn 40, things change. And I kind of look at it, when I was a young doctor at 24, I had a coffee bar in my office. I literally had a coffee bar. People would come in and drink coffee, and I thought it was the best thing for you. It helped you work out better, all this stuff. And then as I, my story I just told you, get to a certain point, you realize, no, this isn't good. And nobody talks about that in medical school or any kind of chiropractic school or anything. But it is an important thing to understand. Not just the coffee, but how the hormones work, how your body works. You can't just play rugby for 40 years and think you're not going to feel an effect of that. Hence my knee replacement this year, But, if you knew this when you were younger, life would be a little different now. But at the same time, there's always a time to take advantage of knowledge to be able to make things better, okay? And that's what I hope we can do with you guys a little bit here. Here's a thermal image of a cup of coffee, actually. And I took this at one of our talks that we did. And we're going to just see from a thermal image, what can we see? Okay, to give you an idea, before we talk about the human body, but what can we see about thermology in the first place? And in this case, I'm going to tell you red and white and yellow are hot, and magenta, blue, and greenish are kind of colder, okay? So what would cause these cold areas here, do you think? Either refrigerator or maybe an air conditioning unit or a vent or something like that. I know that coffee's hot usually. Well, in Florida, they ask you, do you want it hot or cold, I guess, but we just drink it hot. But anyway, in this case, it's hot, and you can see it radiating onto the counter. So it's, heat, yeah, you feel it when you're holding the cup, but the heat is actually radiating outward away from its origin. So with the thermography camera, we can see it's hot all the way out to here, about 6-8 inches from the cup of coffee. Now, do you think if I put a bunch of papers and, debris over the top of that cup of coffee without spilling it, would I be able to get to the other side of the room and take that picture and see where to find it? It's like a needle in a haystack, so to speak. I'd be able to find that cup of coffee just from the heat radiation like we're seeing here, okay? So in the body, that's the same way we're able to find inflammation in the body. Now that inflammation could be from an injury, surgery perhaps. It could be from breast cancer, creating inflammation, thyroid inflammation. What else? Give me another one. Come on. Shoulder injuries, back problems, any of that stuff, right? Sorry, I didn't think that was bad. So thermography is basically a radiation-free. So we're not giving off radiation like an X-ray, but we're perceiving the energy that your body is giving off. So it uses heat detection to locate areas of temperature differences in the body. That may be caused by a number of different things. It could be neurology. It could be we could actually see lack of blood flow is a big one that we see. It's cold, right, instead of hot. Or we can see inflammation, which is hot. One person wanted me to name our system the inflammation station. It rhymes. It sounds cool. I like it. But there's more to it than inflammation is why we didn't do that. Here's breast cancer. Just going to give you some things. Skip around a little bit here. Go at the proper pace. I think this class, the technicians that we teach, this is like the class they take, but I just went like this to it and made it really short. Okay, so some of it might be a little technical, but yeah, you can see the hot, and then like I said, in the black and white, black is hot. Okay, so you can see patterns, and you can see the breast cancer around the nipple. What people don't realize that this is from the 1980s and before. There were over 4,000 articles published on medical thermology. So if you go to PubMed and you type in medical thermology, you're going to get things on heart disease, liver inflammation, gallbladder dysfunction, and you can see them all here, spinal related stuff and whatnot. The AMA was using thermography prior to 1992. Okay, it was accepted not just for musculoskeletal and thyroid, but also for breast cancer detection. Okay. So 4,000 articles, and there are 800 just on breast cancer detection. Okay, and it's probably way more than that now. This slide's about 15 years old. Okay. So it started in 460 BC with Hippocrates. He's the father of Western medicine, right? Everyone knows of him, the Hippocratic Oath, right? Yeah. Anyway, he would put mud and clay on people's bodies, okay, and let it dry. They'd have them stand there like this, and wherever it dried first was hotter. He would mark that area as an area of pathology. So that's what he did. And did you know that the Greeks actually had photographs back then, but they got lost? We actually found one of the photographs from him. Right here, yeah. See? That was him doing this. For those who don't know, it's a joke. He would put mud on their bodies and whatnot. So, and we all know now, especially with COVID and all these things we've been through lately, that the temperature of the human body is important to assess. 1872, Carl Wunderlich, he was the first one to say it should be 37 degrees Fahrenheit, 98.6 degrees Fahrenheit. During COVID, I flew around on a jet plane to airports and Procter & Gamble and everywhere because I'm one of the only trained thermologists in the world that was able to set up these screening devices for fever detection. So we put them in at the Pentagon, I put them in at Dulles Airport, all over the place. They had me flying around to be able to detect temperature. And believe it or not, this right here, the 98.6, was the most controversial part of the whole thing with the CDC. They were saying the fever should be 100.3, okay? And then we went through Russian studies, we went through German studies, we went through British studies, American studies, and nobody could actually agree that that was the number to begin with. So, you know, you have all these data people in the government, they had trouble coming up with a number, okay? And I said, well, let's just make it as low as we can make it. Let's make it 99 instead of 100.3. That way we don't get false negatives, right? So we have people coming through, even if they're hot, all right, pull them aside, then test their temperature, right? So we were putting this at international arrivals in Dulles Airport, and we had a choke point, they call it, where people come through, a couple of people at a time. So we had a camera on them, and we're measuring their temperature, but people were getting through with COVID was the problem, because COVID didn't have a high fever. It worked with SARS in 2008, but it didn't work with COVID, because COVID, people had COVID with no fever. Okay, so this whole thing, all this work I did and everything all that time, I mean, they paid me for it, so I was okay, but it didn't work, okay? But it's a good, interesting point with this guy and the temperature measurements with the body. And I'm gonna go fast through this slide here, but just to give you an idea. 1800s, they developed infrared radiation. They found, Sir William Herschel did an experiment and found that red, orange, yellow, green, blue, violet all had different temperature measurements. And he let the sun move and go down, and he found out that the infrared was hotter than all of it. And that's how he discovered it. They spent 40 years, him and his son, to create the first thermograph on a piece of paper. All right, really cool stuff. Yeah, so they spent 40 years working on that, can you imagine? My friend took this picture of the Boston bomber. In Boston, this is how they found him, with a thermal camera. So talk about the cancer, you know, this is the cancer right there, that guy, right? And I told you black was hot, remember? Yeah. It depends on what scale you're using. Military uses white hot, okay? So white is hot in this case, and that's how they found the guy in the boat. But the military's been using it since 1946. The only difference was it used to take 45 minutes to get a single picture out of it. All right, and I'm gonna skip through, not skip, but let's go, 1956, the guy from Montreal, Dr. Lawson, he created the first study on breast cancer on 26 women that had a temperature difference where the cancer was to where it wasn't of 2.2 degrees difference, okay? Then he published that paper. You can find it on PubMed today. Here's the paper from 1956. It's out there, okay?
Can I ask a quick question? Is it hot because the studies are working harder? Is that why the
There's two reasons it's hotter. One, breast cancer itself develops a bunch of angioneogenesis, little blood vessels inside it to feed the cancer cells.
Right.
So it picks that up, okay? But also it creates inflammation as it grows on the surrounding tissue. So it'll pick that up also. Okay, and I'll show you some pictures in a minute. All right. All right, where are we here? So then, this is what, not even 10 years later, Gershon and Cohen, Albert Einstein Medical School, published a study of 4,000 people with about 94% accuracy, okay? This was back in the 1960s, right? They used something called the Barnes thermoscope. This is the patent from 1968 or 65 of the Barnes thermoscope. So it was patented way back then, right? So anything I'm telling you about we're doing today with this stuff started a long time ago, right? We didn't just start this. By 1972, the Department of Health, Education, and Wellness labeled thermography for health purposes is beyond experimental stages. And they continued to use this for many years, okay? Some people made it was like the mood ring material. You take it and you push it up against the breast, it turns colors where it's hotter. In this case, I think hot was actually bluer, okay? Or green, actually. But you would take a picture of it with a camera, like a Polaroid camera. And that's the accuracy, but they actually got government sponsorship and 95% roughly accuracy out of that technology. Imagine what we could do today with what we have, you know, with all the computers and everything, right? And just so you understand, you know, we understand with visible light, here's the electromagnetic spectrum. When you turn your radio on in your car, that's what you get. X-rays, that's what you get. Infrared's between microwave and visible light. It's a frequency of energy. And I don't know if you know it, but you're giving off X-rays right now, right? So, and you're giving off gamma rays. We're all giving off all of that, right? Even that chair is doing it. So when I take a picture with a thermal camera, I'm filtering the frequency down to just this little area right here of infrared. Okay, in fact, it's only a portion of infrared. So the things we were looking at, one of them is the thyroid you mentioned earlier. We're able to see the thyroid. It gets hotter usually when there's a problem. So people say, well, I have a hypoactive thyroid. Okay, so it's not active, so it should be colder. No. The cells that are remaining in the thyroid are showing up hotter, all right? And that heat is what we're detecting because they're overworked, those cells. Hyperactive thyroid, they're all working hard, right? Hypoactive, you have cells dying off that aren't working, so the others have to work harder. And we'll see these little spots like that, or it could be a big, broad, diffuse area, or it could be just a little focal area. And of course, thyroid cancer should show up like this too. So that's the thyroid. This would be a trigger point here. And that's low back problem. So when you're walking unevenly and you haven't been to the chiropractor for a while, you're going to start irritating the low back. And it's going to start looking something like that. See? If you're on your phone too much, text neck or whatever, you had a car accident, you're going to get these trigger points and these muscle spasms in there. Okay, so that's what we're looking for from the spinal aspect. From a neurological aspect, we're looking here at blood flow. And you can see this toe here is colder than this toe. This guy had a disc herniation on the right side of his low back that was stopping the blood from going down into his toe. Okay. Now you could also do diabetic neuropathy and other things that will do similar things, peripheral neuropathies and whatnot. You had a question?
Green like the ideal temperature?
You can say that, but really there's rule of thirds, we call it. It should be like 1/3 warmer colors, 1/3 in the middle, and 1/3 colder, like a balance, okay? And symmetry is the most important thing that we look at. So we'll measure what we call delta T's. So we measure temperature differences from left to right. Those are temperature differences we're looking for. So it's not the color as much as is important. Cerebral vascular screen, look at this guy here. His forehead is black right here. Black is cold, as cold as it gets on our scale. So why, let's just see it. Well, you might be reading this, but why would you have a cold spot here and not here, for example? So, can you guys think of anything?
Tumor.
What is it?
Tumor. Tumor.
Tumor.
Oh, tumor. Yeah. Actually, in this case, it was a tumor. But the answer I was really looking for is like a closed off carotid artery, right, on one side. So you know they do the Doppler ultrasounds for carotid arteries. You know, we can look at it as well and we can say, well, it's colder here than here. So therefore, you have something that's either closing, it could be a tumor, but usually it's plaque in the arteries that's closing it off, right, or something like that. In this guy's case, it was so extreme, he did have a tumor in there, and we were monitoring him until we took this picture. He passed away 3 weeks after this picture. There wasn't much we can do for it. So, you know, the FDA approves certain things or clears certain things that we're allowed to do as a screening, and it's an adjunctive screening in addition to something else. One of them is not testicular cancer. We just happened to find this on this guy. If we put paperwork into the FDA and paid about $100 million, we could probably get what they call a PMA, pre-market approval for this. But who has $100 million to spend on that, right?
Yeah.
But we can measure your skin surface temperatures and see if they're hot or cold, and if they look like this, we would advise you to get it checked, right? Oral wellness, look at the mouth. Remember, dark is hot in this case. So her mouth, she has gum disease. It's so bad that it's pressurizing and creating these channels down into her mouth, into her neck. You could follow it down to here. You can follow it down to that right there. You see that? See that? And then you can follow it from there to her nipple. So the stuff from her mouth is leaking all the way to her breast. Right? What other test is going to show you this? There's
How
nothing.
does it do that?
How? So imagine I turn on a faucet, right? And I restricted it, like I sealed off all the doors, and I just have the water pouring into this room. It's going to find the path of least resistance, and if it doesn't have one, it's going to make one. It's going to push through the caulking or something, and it's just going to push through your tissues in this case. And it's going to, gravity is going to help it, of course. It's not going up. Gravity, and then whatever pathway it can find and push its way through because of the pressure, it's going to do that. And she's not the only case we have of this. It's pretty common. Okay, this is just really clear. Like you can see it, it's just directly to the nipple. Yes?
Is that something that you would find on like the whole body scan, or that's particular, like you're doing her?
Like if we did just breast on this woman, we would see something coming from here, okay, and we would assume it's coming from her mouth most likely. But it could be sinuses too. It could be like a sinus infection or tumor in the sinuses, or possibly the thyroid itself too. But whole body, we see a lot of really amazing things. You know, it's really things like, you know, I can't show you every picture. I'll show you some more that are pretty cool. But you'll see things like we'll have alcoholics that their whole liver is just backed up with heat and inflammation. It's crazy. I already showed you this one, so on the other picture, on the other presentation. But again, you can see the heat here in her breast is cleared up after making lifestyle changes. I wish the woman with I wish I followed her and she took care of it, and we could take, I don't have a follow-up image of her making it better, but that would be pretty cool if we had that. Lymphatic care. All right, so this woman did have breast cancer right here. She came into me after she had a lumpectomy. She had it cut out. My first thought was they didn't get it. That's what I thought. They didn't get it. But what happened was the lymphatics from the cancer were all clogged up. So we helped her with vibration treatment to get that out of there. And I don't know the time, was it November to February? She's almost totally clear. So if she didn't do that, luckily she came in soon after, what would have happened is it would have scarred off, and she would have kept all that toxicity in there. And it could have breast cancer cells in there and whatnot, and it could have regrown, reseeded itself again.
Is vibration the same as radio waves?
No. So it's, Dr. Hartley, do you guys use vibration here? You do, right?
Yeah, the whole body vibration
Yeah.
plates.
So the whole body vibration is what we're talking about in this case. And I actually told her at home too to use a hand vibrator on here as well. So she did that at home. She did the full body in our office. She did dry brushing. She did a lot of things that, a lot of nutritional stuff too. But in a short period of time, she cleared it out. This is one of the worst ones here, right? Just the regular everyday bra, right? You can see she had this off for 15 minutes, this bra, and then I took that picture. So you can see the inflammation that it creates. See the shoulder depressions even? That's like bone that's grown the other way. I like to equate it to a tourniquet when you go for a blood test. It's only for a minute or two. They put this thing on you. What's the purpose of it? To stop your blood flow, to stop your interstitial flow, and to create pressure here. But we're wearing these things all day long, stopping the interstitial flow. And I know it's pretty sensitive here in Florida, but where do most women get their skin cancer? It's usually right in that area, right? Well, again, we know it's from the sun, from the solar, but if perhaps your body was able to communicate with itself through the soft tissue, meaning your interstitial fluid being able to flow and get from point A to point B, it might wash some of those cancer cells out and allow your immune system to work. Okay, so keep that in mind. This was a pre and post, we were talking about caffeine earlier. Caffeine, no caffeine for 6 months. See the difference in her breast? Big difference, right? This is just a vascular finding we found. The woman had vein surgery, and afterwards, you can see that that was cleared out pretty good. Not here promoting vein surgery, but sometimes, especially if it's DVT, who knows what's going on there. You should always get it checked, in other words. And if we see something like that, then we'll send you a vascular guy to take a look at it. This here, yeah, so she had a mammogram 2 years prior. She had nothing going on, okay? And then she came in to see us, and that's what she had. Then she went back for a mammogram, and they found a suspicious area there. But look how fast that thing must have grown, okay? Because it's super hot, okay? But that's what we're looking for. That's not what we're looking for. We're looking at it to be about this big, okay? Before it gets to this point. Okay, so.
How good is it for dense breasts?
So dense breasts are a problem for X-ray because a tumor, picture an ice cube in water for that matter. It's water. Let's just say it had the same density, although the ice is slightly different. And you take an X-ray of a glass of water with an ice cube, you're not going to see the ice cube because the density is the same. The problem with dense breasts with mammograms is that the density of the tumor is the same density as a dense breast, so it doesn't show up.
What about with 3D? Even
3D doesn't matter, okay? Because you're literally not seeing through the breast and differentiating the tumor, okay? MRI is slightly different, ultrasound slightly different, okay? So you got to find what the right combination is for you. Like we just said, you know, thermography is not a standalone procedure, you know, but if you mix it with ultrasound, it's a better combination, right? And we have a lot of women that do mammography and they do this. Mammograms are really inaccurate, not just dense breasts. I mean, they're at an 82% accuracy, and that's pushing it. I know people that were on the board of that, making those numbers work, because it has to be 82 to be approved. And it really, there's a lot of people that know that it's way under that. They take out a lot of outliers. They take out a lot of the dense breast women to get to that number. So they're at the point where they're testing 60-year-olds and not 40-year-olds, you know, and that's, don't get me started on that. But you can read the articles on PubMed. New England Journal of Medicine in November 2012, the best article possible. But dense breast and thermography, we're looking for heat, so dense breast is not a problem for us. There are some limitations. Obesity is a slight, it could be a fair limitation. Big breast implants, I'm talking about like big, you know, you're not going to get a mammogram through that either, right? Or an ultrasound for that matter. So there are some limitations like that. But for the most part, by the way, these are the temperature differences that we're talking about. So we measure the temperature differences, and every time you come in, we compare those temperature measurements to see if they're increasing. They should fluctuate a little bit, but they shouldn't keep going up in a straight line.
Is it advisable to do this maybe once a year, or, you know?
Yeah. So what we shoot for is once a year with our patients, and I have some people that do more. I have cancer patients that do every 3 months. I have some that do once a month. Some people want to do every 6 months just because they're really trying to make changes in their lifestyle and they want to see what it looks like. But once a year, yeah, if we had a graph of you, like I have a lot of people 15 years in a row coming in, and you could just see their history. And it really is good. Now, that kind of baseline, right? I don't like showing this picture, but I'm showing it to you because you can see in 6 months how it goes from here to here. Okay, so if you couldn't see it on the surface, and it's just a horrible picture. I mean, I showed this at in Orlando at a plastic surgery center. I did a presentation, and there were women in the back standing. There was no room to sit. And so one woman literally passed out when she saw this picture. Yeah, it's horrible. But, you know, this is what obviously we're trying to avoid and not find in people. Here's another progression. This is where we want to find it, right here. See it? And we did. We found it on this woman in February of 2012. We found that breast cancer. She wanted to try some natural methods, alternative treatment, and 3 months later in May, got a lot worse, right? So we tried to persuade her at that point to go take care of this, you know. And she said, well, maybe I didn't take the medication, the nutrients right. So she waited another 3 months. Wow. Now she's got inflammatory breast cancer. Then she decided to go to Spain for some kind of cancer treatment. Came back, looked like this in September and died by December. So from February to December, this is the progression. We highly suggest taking things seriously. Of course, getting tested is the first step.
10 months?
10 months, she went from that to that. Not knowing she had anything to just taking over her body. Now, can you imagine, we would have saved her life if she would have listened to us. I don't tell people what to do. I just say, hey, go see a doctor. This needs to come out, okay? There's a time for natural treatment and a time for mainstream care. This was the time for mainstream care, okay? Anyway, long story short, that's not who anybody wants to be. You want to catch it here. First step is getting tested, right? So our system is set up where we have 3 interpreters look at every report. Okay, we have level 1, level 2, and level 3. Dr. Sepper right now happens to be our level 3. He's got 45 years of experience now in thermography. He was from the former Soviet Union. He's now in New York doing this. He's a U.S. resident, citizen. And he worked, that's all they did in the Soviet Union for women, is they tested with thermography. All right. So we are getting things started here in St. Augustine is what we're doing with Dr. Hartley and his wife, Carrie. We are doing screenings Thursday and Saturday. We have some open times. We would like to get you guys all started. We took approximately $100 off each test to be here to get people to do it. So Carrie and Chelsea will be taking appointments over here in the other room for you guys who want them.
Can you explain the different tests that you're doing?
So there's the breast is breast only. There's 6 views of the breast. So if you're only concerned with your breast, then that's the test to do. It is it's $225. So it's a little bit different in price, but it's only $70-something different than the torso, which is basically from head to hips, okay, without the arms or legs. That will get you your torso, your thyroid, your face, your head, your neck, your breast, and from then it gets the testicles. And the full body is an extra $50 from there, but it gives you everything. And I suggest, you know, usually if it comes down to if you want to spend the extra money or not, if it's not that big of a difference to you personally, go for the full body at least the first time and see where you're at. And we will either we'll be incorporating it here with the Hartleys, or I'll be back here next year again doing the same thing we're doing here today. So you'll be able to constantly get your test. And like I said, we have 200 locations, so you can go to other areas. We do have other areas in Florida right now too. If, let's just say this didn't flourish for whatever reason, there's other areas in Jacksonville, there's other places nearby, all right? So obviously we want to get started here. We want you guys to be happy here. The screening is all private. We have a privacy set up in the back in a private room, so no one's going to see you, okay? It's just you behind the curtain. And it's about a 20 to 30 minute test is what it takes. There are protocols you have to follow, which are, we'll get you the link to be able to read those and do them 24 hours beforehand. And that's about it. So what we'll do is we'll also, we're including a discussion of us going over the report with you in that price, which is usually another $50. So it's like $150 savings basically. But we're doing that just to get started. I'm sure the pricing will go up next year if they incorporate it, okay? But for now, this is a good time to get started as an introduction to see what it's doing for you guys.
Question I had for you was, does that, and you may have said it includes interpretation, so where does that interpretation take place? On the phone?
Okay.
In person?
Interpretation is written, and the consultation is on the phone, okay? Or Dr. Hartley, I don't know if you're going to do any of them, but if it might be in person even, but I don't know what we're doing about that yet. But definitely with me and Kim, they are included on the phone for sure. And actually, if we're still here, it could be in person if you wanted to Yes, ma'am.
And let's just say you find something and we wanted to get hormone treatment, can we do that through you if that's something that, you know?
So we don't do treatments, we do interpretation, evaluation, but what we do is, Hartley's here to do nutritional testing, Kim does hormone testing, so you could, as a separate sort of entity, do that with it. If you couldn't, we prefer you to find somebody that does it locally, because we feel that it's just to keep it locals better, okay? But if you can't find somebody, we definitely have that available for you, okay? And I'm sure Dr. Hartley knows people as well.
How long does it take to get results from the time?
Oh, you'll get the results back in a few days, usually. I mean, we have 3 levels, so it depends if it's a weekend or if somebody's away for the day, but it has to hit all 3 interpreters first and then get back to us. Let's just say less than a week.
So say you've got like a lot of arthritis, is that all gonna?
If it's creating inflammation in your body, we'll see it. And
but how do you distinguish between that and cancer?
through differential testing. So in other words, and also through heat signatures that we recognize. So there's things that we'll see, yeah, that looks like it's just arthritis, or that doesn't look right, you know, that's something different. And, you know, it's like if you came to us, like in my personal office, I do it while you're right there, okay? And it's different than, you know, because I could see you. I'll give you one example. I think I have a pimple on my nose. This would show up hot, right? Oh my God, does he have skin cancer or does he have a pimple? So I get my report back. What, it could be skin cancer? I forgot I had a pimple on my nose a week ago. You know, there are those little things that are an issue, but for the most part, it's 95% amazing, okay? You might tell me, oh, I had a pimple on my nose that day, you know, and say, oh, okay, well, that's fine, don't worry about it. Or I may tell you to go to the dermatologist and go get it checked, because I don't like the way that looks. And probably I would tell myself that today. Yeah.
You know, what about like differentiating between organs within your body too? Because I'm thinking like the lungs are right there in the whole, you know, chest cavity.
Anything deeper is harder to see. Anything that radiates heat to the surface, we're going to see. So we're looking at skin surface temperature measurements. Thyroid's obviously easy, breast is easy. If you have a bigger abdomen, it could be a little harder, a little more difficult. It's not really cleared for certain things. We're looking at skin surface temperatures. Have we seen colon cancer? Yes. Have we seen ovarian cancer? Yes. It's not a great screening test for some of those lung cancer, but if it's there, at times we do end up seeing this as well. So it's one of those tests, sort of like a PET scan, right? Without the radiation and the injection. We're able to see a physiological function of the body. Okay, with a PET scan, you're able to see areas of heat from faster metabolism of sugar, radioactive sugar. We're able to see it just from your body heat and radiation of your heat. So there's no perfect test. We're not going to see every possible thing. But gosh, I think if you combine that with blood work every year, you got a home run for your health. You put both together, it's like you can't do better.
Now, so we'll have a physical copy that we can give like our GP.
With all the pictures in it,
Okay.
all the comments, then you go over it with one of us.
Okay.
We'll there's a lot. Usually there's a lot of people, and we'll just say, yeah, well, that, you know, the hormone stuff you have is pretty average, or even better than average, or you know, you really should start working on that, you know, or whatever we tell you. But usually by the time you're done with us, you understand it really well, and then we'll send you to the doctor for that pimple on the nose check or something like that, you know, the skin tag or whatever it is that looks funny to us, and then you get that checked. It might be the mouth, it might be a TMJ problem, it might be a chiropractic problem, so there might be any of that available that you have to get checked. But you know, then you get to know your body. Next year, you'll be like, oh yeah, actually that looks better. Oh, I did a good job with that, you know. Dr. Hartley did a great job on my back, you know. You can tell it's better, you know. Or my thyroid medication is working, or my nutrition's working, or anything like that.
The preparation that you were talking about, does that include no caffeine?
4 hours before. 4 hours. But then again, if you do it, then you see the effect, then you know that's part of what you have to work on. 4 hours is enough for that. Don't worry. Don't worry. So if you have coffee in the morning and you have a 2 o'clock appointment, you're good.
You're good, okay.
Okay. And we do have, you know, I think we had about 10 people sign up already, so I think we have close to 10 or more. We'll make room for everybody that wants to come in. But I think they need their office back because they have patients come in. So if we could go out into there, and if there's still more questions, I'll answer them. And Carrie and Chelsea are there to make appointments for you guys.
Thanks, Dr. Piana.